स्क्रीन दिख रही है मेरी? शो हो रही है स्क्रीन?
हाँ जी।
ओके. So basically, including bodies indicate specific type of hemolytic and or regenerative anemia. Leukocyte shift increase number of the immature neutrophils like neutrophilia, eosinophilia, lymphopenia. These are the WBCs. Reflect different inflammatory or stress responses. Platelet and coagulation tests help diagnose bleeding disorder, DIC, and anticoagulant toxicity. And blood smear evaluation is critical for morphological abnormalities and cell count. So there are two type of cross match, major and minor. Major is most important. Basically, it identifies the SO antibodies in the recipient plasma that may cause reaction. For example, if there is a donor A with blood group A and donor B with blood group A, both have same blood group. So, uh, so antibodies already present, sorry to say, in B, uh, A is the donor and B is the recipient, and both have same blood group. So SOL antibodies are not present against the antigen A, so we can give blood group A. So basically, it detects the antibodies in the recipient plasma against the antigen of the donor. So before transfusion, we have go for the major cross match. And in minor cross match, this is a reverse. Detect the SO antibodies in donor plasma that could affect recipient. Or this is least important, but major cross match is most important. Minor cross match important in animal with the naturally occurring SO antibodies like in cat, certain dogs breed like German Shepherd, and period transfusions and multiparas smears. This condition is important. So before blood group or donation, we have go for the major cross match. But if we know there is a certain cat breed, dog breed like German Shepherd, or there may be multiparas animal, we should also go for the minor cross match. These are different blood volumes. In horses, there is 80% of body weight, and in cat, there is 6.5%. So there are bile acid and bilirubin. Their bile acid function basically the uh, liver function involved in the liver function, and in protosystematic shunt elevated in the liver dysfunction. And bilirubin hemolytic disease cholestasis when there is a stoppage of the bile. We can see increase plasma bilirubin in cholestasis, increase in hemolysis and biliary obstruction. Just go through it. This is not important, just to have a concept of it. But what are the function and the bilirubin? This table is important. Different liver enzyme. ALT, alanine aminotransferase. This is the liver enzyme, ALT, where we can see this elevation of the ALT in hepatocellular injury, like hepatitis, necrosis of the liver. This is the more liver specific than a AST. AST is also the liver enzyme, but ALT is more specific. Mild elevation in the muscle injury. So common condition like drug toxicity, cirrhosis, and viral hepatitis. AST is liver enzyme, but also involve heart and muscles. When you can see the where you can see the hepatocellular injury or extrahepatic source outside the liver, you should go for the AST. But if there is a hepatocellular injury and intrahepatic source, you should go for the ALT. Basically, AST is not released from the liver. It released from the outside the liver, but this is also the liver specific. Also can see in the myocardial infarction and rhabdomyolysis. ALP primary source is liver and bone. You can see in the cholestasis or biliary obstruction. Alkaline phosphate. There are five types: liver ALP, placenta ALP, bone ALP, and leukocyte ALP, and corticosteroid ALP. This last corticosteroid ALP occur only in the dogs. Elevated in the growing animal and pregnancy. Paget disease. Paget disease is basically the uh, abnormal growth of the bones. Or when we give steroid, you can see the elevation of the ALP. This table is important, and these are the GGT gamma glutamyl transferase. Origin is liver, bile duct, and kidney. You can see in the cholestasis, alcohol toxic induced injury, more sensitive than the LP for the biliary obstruction. In neonate, when we give medication, the GGT may increases. You can see in the bile duct blockage, alcoholic hepatitis. SDH, sorbitol dehydrogenase. It is only present in the large animals. When there is acute hepatocellular injury, not chronic, here is acute hepatocellular injury. Have short half-life useful for the recent damage. So basically, SDH present in the large animal in acute hepatocellular injury. PK, uh, basically it released from the muscles, breakdown of the muscles in rhabdomyolysis condition. Also involve the heart and brain, but major origin is the muscle. And also in the inophore toxicity, because in inophore toxicity there is a rhabdomyolysis. This is not a liver specific, rapidly rises and fall. It mostly increase after the injury. So snake bite, myopathies and trauma. LDH, lactate dehydrogenase. Liver, muscle and RBCs and heart are the origin. This is non-specific liver enzyme. So you can see in the hemolysis, hypoxia, generalized tissue damage. Lactate increases in the hypoxia, anemia, hemolysis, or generalized tissue damage. So ALT is the liver specific. AST is the liver, gamma, heart and muscle. Liver plus heart and muscle. So ALP was GGT. ALP, bone or liver. Origin is bone or liver. Check GGT to confirm liver. If there is increased GGT, there may be ALP rise. Note, let me check in bone marrow liver. Check GGT to confirm. So basically, ALP is the bone released from the bone and liver, and GGT increase released from the alcohol or cholestasis. STH and CK are the muscle injury, pure muscle injury, not involve liver, and STH acute liver damage in large animal. And LDH is not specific need correlation with other tests. So these are some clues. You can differentiate and diagnose different conditions by the help of this chart. When to use which marker? Hepatocellular injury, ALT and ST, cholestasis, ALP and GGT. GGT is more sensitive in the cholestasis condition. Muscle, West liver. CK involves muscle and ALD involve liver. There are some electrolyte like serum albumin, potassium, and calcium. Serum albumin नॉर्मल है, नॉर्मल मोर देन 50% of total serum protein. In a hepatocellular liver injury, there is low level of plasma protein, albumin, or there is any renal problem, nephropathy, and increase in the dehydration. So total volume of the blood decreases, but there is same amount of the protein. So in dehydration, there is increased albumin. But in dehydration, basically, liver produce more protein, more albumin. So so more water will come into the veins. So to compensate the dehydration, potassium hypokalemia causes the paralysis, ventroflexion. This is important. What are the effects of the potassium? And hyperkalemia cause the cardiotoxicity, cardiac arrhythmia, and muscle weakness. Calcium, hypocalcemia, eclampsia. Eclampsia basically the basically after a week in the pregnant mare or bitch, you can see convulsions, seizures to the low level of calcium. This condition is caused the eclampsia. This is rare, but can be seen with low level of calcium in the pregnant uh, mares, bitches. Hypercalcemia, idiopathic, and neoplasia. Basically, in a cancer or neoplasic condition, there is an increased level of the calcium plasma, maybe due to the idiopathic affect neuromuscular function. So in cancer or tumor, there is a increased plasma calcium. Pancreatic enzyme and function test. Pancreatic lipase. Purpose to diagnose pancreatitis. False positive possible with the renal disease. If there is any renal disease, the test may be false positive. So most important test is the trypsin-like immunoreactivity. If there is a pancreatitis, we should go for the trypsin-like immunoreactivity test. Amylase and pancreatic lipase should be the second option, but first option should be the trypsin-like immunoreactivity. Amylase elevated in the pancreatitis, less specific than the lipase. First go for the trypsin, then lipase, and then amylase. This is important. Trypsin-like in pancreatitis, we should go for the trypsin-like immunoreactivity. Chylothorax, chyle, accumulation of the chyle, white milk after the meal. So thoracic duct obstruction, blockage of the lymphatic system in the thoracic duct, trauma, chronic heart failure, or mediastinal mass. These are the conditions we can see the chyle accumulation. These are basically the white, pink, opaque, high triglyceride, high fat, white, pinkish milk. Lymphatic drainage from the GIT into the pleural cavity. If this drainage block, you can see the accumulation of the chyle in the thoracic cavity around the lungs in the thoracic cavity. Electrolyte and acid base balance. We already discussed about the anionic cap, metabolic acidosis, metabolic alkalosis, and respiratory acidosis and alkalosis. If you don't understand anything, you can ask later on. Okay. Urinalysis, urine pH. In herbivores, normal pH is alkaline. In carnivores, normal pH is acidic. And hyposthenuria, acidonuria, and hyperesthenuria. Basically, it is the specific gravity of urine. Hyposthenuria when there is low specific gravity than the plasma. Acidonuria when equal Hg to the plasma, and hyperesthenuria when increase specific gravity than the plasma. So these values are important. This is also important in herbivores, alkaline urine, and carnivores, acidic urine. Bilirubin in urine, usually absent, brownish green color, hemolytic disease and cholestasis. You can see the bilirubin in the urine, yellow urine, brown green color urine, okay, in the hemolytic disease. Leukocyte, pyuria. Pyuria basically the WBC is in the urine. Normal values are less than 5. You can see elevation during the UTI, urinary tract infection. Cystocentesis basically the when we puncture the bladder to remove the urine. So this called the cystocentesis. Contraindication in the bleeding disorders, ascites and diphtheria. Avoid in painful and difficult cases. This is important renal function test. One, elevated in the pre-renal azotemia. Azotemia is basically the elevation of the nitrogen compound in the plasma. Elevated in the pre-renal, influenced by the diet and hepatic function. Creatinine, sensitive for the renal failure, less affected by the diet and muscle mass. If there is a acute renal failure, there may be increased level of the creatinine. And glomerular filtrate, measure kidney function rate, assess via the clearance test. So liver enzyme help identify hepatocellular cholestatic injury. Electrolyte imbalances like potassium, calcium can cause significant clinical signs. Cross matching ensures safe transfusion, especially animal with the prior exposure or natural SO antibodies. There are different type of crystals, struvite, triple phosphate. Their shape is important. They may show the picture, and they may ask about what are the second name of the struvite, what appearance, and it is alkaline or acidic. So struvite is basically the uh, alkalinic crystal, often found in the alkaline urine associated with the urinary infection. These are the coffin lid shaped magnesium ammonium phosphate crystals, triple phosphate. Calcium oxalate, these are the square diamond normal urine can form in the hypercalcemia. Okay, when there is a high level of calcium oxalate and monohydrate. This is important. You can see the calcium oxalate and monohydrate crystal in the ethylene glycol toxicity. These are their shape, like dumbbells, weight dumbbells. Calcium carbonate, these are the wheel, car wheel like, bike wheel like shaped, common in the healthy horses. This is normal founding in the healthy horses. Uric acid, amorphous yellowish or orange granules common in the Dalmatians because Dalmatians don't have the enzyme to destroy the uric acid. Amorphous phosphate, granule precipitations found in the alkaline urine. This is also the alkaline crystal. So this calcium oxalate is acidic, calcium oxalate monohydrate is acidic, calcium carbonate is acidic, uric acid is acidic, and amorphous phosphate is alkaline. Ammonium biurate, brown thorny stellate crystal seen in the animal with a protosystematic shunt. Okay, cast. Cast basically the proteinous structure formed in the nephrons or tubes. Signs of the kidney damage or tubular damage. If there is a more cast, there is more chances of increased kidney damage. or tubular disease. There are different type of cast: hyaline, hyaline and cellular, waxy, granular, and waxy cast. Hyaline is the clear, semi-transparent, mild glamular leakage. When there is a mild glamular leakage, you can see this cast. In cellular, contains epithelial cells, RBCs and WBCs. Indication: tubular damage, hemorrhages, infections, pyelonephritis, infection of the nephron. Waxy, filed, blunt, opaque, and squared end. Chronic tubular degeneration. Granular indicate ongoing damage, tubular degeneration. Waxy cast, severe degeneration, wild, blunted, severe chronic renal damage. Chronic renal failure, you can see the waxy cast. These are different, like hyaline, clear crystal, hyaline with the fat, hyaline to fine granular, cellular cast, cellular to the coarse granular, coarse, more aggregation, coarse granular, fine granular, granular waxy, and waxy. These are different cast or with different conditions. So this is important. What is the name of the proteinous structure found in the tubules? I will I will share later on. Anyone have idea what is the name of the proteinous structure found in the tubules? They may ask the name. Let me check. Wait a second. I will share later on. Okay.
Phosphol protein.
What?
Thumb phosphol protein.
Okay, okay. This name is very important. You have to remember.
Yes.
So proteinous structure Holstead protein. Holstead protein. Okay. Let's discuss about different tumors. These are the mast cell. They may give the picture. You have to go remember this picture. This is the mast cell tumor. Um, this may be metastasized. Basically, this is the cytoplasmic granules variable appearance, and you can see blue dots in the cytoplasm, and this can metastasize. Histocytoma. Young dog dome shaped ulcerated. Basically, the this is the type of the immune cancer of the immune cells. Okay, histocytoma. Young dogs dome shaped ulcerated. Spontaneous regress. No metastase. This is not metastase. So this is the histocytoma. Lymphoma. Tumor of the lymph nodes, lymph tissue, solid tissue region, spleen, lymph nodes, and bone marrow. Malignant lymphoid proliferation. This can metastasize. Plasmacytoma, tumor of cancer of plasma. Round eccentric nuclei, dense chromatic polymorphism, usually benign, skin or oral. Okay, this is the shape. Blue, large cytoplasm, and dark blue. Eccentric nuclei, dense chromatin, dark nuclei. Melanoma, malignant pigment, variable shape, malignant common in the oral and mucosal side. Basically, melanoma is on the skin. Tumor of the melanocyte present on the skin that produces the black pigment. So if there is increased melanin, you should suspect a melanoma. TVT is very important. Abundant cytoplasm have large vacuole. They have low cytoplasm ratio, but large vacuoles are transmissible via contact and regress possible. What is the treatment of TVT? Anyone have idea?
Vincristine.
Yes, we give IV vincristine. So basically, this is. But let's discuss about the ester cycle. The most important thing in the ester cycle of dog is LS search, and they may ask about the question when we give cross or cross after the LH search. So LS search detection. Daily testing is crucial. LS search indicate day zero with ovulation occurring approximately 24 to 48 hours. Basically, the ovulation occur after 2 to 3 days after LH search. So we should detect LH search after 2 to 3 days. We can go for cross. Use urine or blood test like SNAP ovulation test for the dog for accuracy. This is important test, SNAP test. So in an estrus, basically there is predominantly parabasal intermediate cells, low cellularity, and few neutrophils and bacteria. In proestrus, before the estrus, shift from parabasal, then intermediate, and then superficial cell. Basically, it in estrus there is more superficial cells. In estrus, in proestrus there is low superficial cell, and in anestrus there is least superficial cell. So proestrus shift from the parabasal, intermediate, and superficial cell RBCs present. In estrus, more than 90% conified superficial cells are present, and diestrus sudden decline in the superficial cell neutrophils and bacteria and reappearance. Okay, you should go for type of cells in each stage. These are different cells. Like this is first one is parabasal, intermediate, and large intermediate. Okay, this is the parabasal cell. Number B is intermediate, and number C is also intermediate. And D are the superficial cell. They have less nucleus, more cytoplasm, more cornification. Okay, more spikes. Superficial with the pycnotic nucleus. No bacteria. Okay, and E is the anuclear superficial cell. There is no nucleus. You should remember this type of cell and shape. Okay, microbial. This is not important staining. Okay, just go to this is important ground stain and acid fast staining. They may ask about what stain we use against which bacteria. So gram stain uses crystal violet, gram iodine, ethanol, and safrarin used to diagnose cell by cell wall type. Can gram positive and gram negative. Acid fast staining is important, and we use against the tuberculosis. After staining with the basic fusin, acid fast bacteria resist decolorization by acid alcohol. This is not important. Okay. Acid fast bacteria are red, non-acidic fast cells are blue. So acid fast stain against tuberculosis. Okay. Methylene blue. This is not important, just this keep the uh, basic concept. Methylene blue is the basic dye, which means it carries a positive charge and bind negatively charged cellular component. Okay. Basic dyes में आता है methylene blue and crystal violet that attract to the acidic portion of the cell when pH is less than 7, including the example like DNA, RNA, ribosome, and sulfate carboxyl group in the protein. And acid dye like osine and Congo red go for the cationic structure. Cationic structure have negative charge. They stay in cytoplasmic protein, collagen, and mitochondria. So,
तो यहाँ पे केटाइन का साइन नेगेटिव होगा।
yeah, cation have negative charge.
जैसे इनका पॉजिटिव नहीं होता केटाइन का।
Cations are negative charge. Let me check again.
केटाइन्स
बेसिक
पॉजिटिव।
डाइस जैसे यहाँ पे बताया है ना, मिथाइल ब्लू बेसिक डाई है, means it carries a positive charge and by negative charge cellular component. ओके. तो यहाँ पे बताया एसिडिक डाइस में क्या है, यूसिन है, कॉन्गो रेड है. ओके. तो ये जो एसिडिक डाइस हैं वो लाइक टारगेट बेसिक केटोनिक. लेट मी चेक केटोनिक. अच्छा, केटाइन आर पॉजिटिव चार्ज, सॉरी टू से. anionic anion are negative charge and cation are positive charge. So basic dyes like methylene blue and crystal violet are attract to the acidic portion of the cells, anionic portion of the cells. Okay, they have negative charge. And acidic like eosin and cango go for the positive portion of the cells, like protein, collagen, and mitochondria. So cation पे होता है पॉजिटिव चार्ज. ये चीज़ें थोड़ी बहुत कंफ्यूज हो जाती हैं समटाइम्स, जितनी आसान होती है ना. तो बस ये थोड़ा सा बहुत कंसेप्ट लेना है इसका. ये इंपॉर्टेंट है, एसिड फास्ट हम किसके अगेंस्ट यूज करते हैं. सो बस ये है. कैटलिस्ट टेस्ट इंपॉर्टेंट नहीं है वैसे, ये स्टेप्लोकोकस के अगेंस्ट हम यूज करते हैं. ओके. कूम टेस्ट, direct test for antibodies complement bound to the RBCs useful for the diagnosis of immune mediated hemolytic anemia. In IMHA we go for the Coombe test. बेसिकली ये क्या करता है कि एंटीबॉडीज को देखता है और जो ना आरबीसीज के साथ बाइंड होती हैं. इनडायरेक्ट इनडायरेक्ट डिटेक्ट फॉर फ्री एंटीबॉडीज इन द सीरम. जो इनडायरेक्ट टेस्ट होता है वो जो सीरम के अंदर एंटीबॉडीज होती हैं वो उसके उसे देखता है. लेकिन डायरेक्ट में ना जो आरबीसीज के ऊपर बाउंडेड एंटीबॉडीज होती हैं वो उसे देखता है. ये फर्क है इसमें. जो इंटरैक्ट टेस्ट है, फ्री एंटीबॉडीज इन द सीरम रेलेवेंट फॉर कंडीशन लाइक द न्यूट्रल एसो एरिथ्रोलाइसिस. सो इंटरैक्ट टेस्ट हम इसमें जाते हैं. न्यूनेटल एसो एरिथ्रोलाइसिस वी विल डिस्कस इन द मेडिकल पोर्शन. व्हाट इज द न्यूनेटल एसो एरिथ्रोलाइसिस. सो इन EMHA वी गो फॉर द डायरेक्ट टेस्ट. ये टेबल देख लेना. ये इसकी मीडिया की जरूरत नहीं है, बस ये देख लेना कि किसके अगेंस्ट क्या हम यूज करते हैं. यहाँ से वैसे क्वेश्चन आया नहीं है कभी, लेकिन पढ़ना चाहिए. Fungal diagnostic dermatophyte test. A color change indicate a positive test for the fungal infection like ringworm. The different fungus give different color eh, when we put ultraviolet light, but dermatophyte give that color. Utilize the tooth push technique for sample collection from the cat. So when we put ultraviolet light on the dermatophyte, uh, it will give that color. So their shape is not important. Different बैक्टीरिया with shape, बट पता होना चाहिए. हाँ, ये इम्पोर्टेंट है. न्यूरोरिक्टिशिया रिक्टिसाई नोन फॉर द काजिंग पोटोमेट हॉर्स फीवर, potomic horse fever. This is important. They may give picture. This is the Babesia bovis in the cell. Okay, a tick-borne intra-erythrocytic protozoan in the RBCs. You can see the Babesia bovis. Okay, this is also important. Anaplasma. This is the intra-erythrocytic bacteria transmitted by the ticks. It is on the RBCs. Okay, not inside the. This is also important, and this picture is also important. Travolta test used for the diagnosis of the FIP through the observation of the avian behavior. Okay, there are different type of cells against different viral disease. Anti-mullerian hormone employed in diagnosis related to the ovarian remnant or the cryptorchidism. We will discuss this condition in medical